I don't forget. There we go. And then today, just for a couple other housekeeping things, we will be in a listen only mode. So what that means is if you do have a question, we ask that you type that into chat, and you'll be able to find that there, maybe there at the bottom of your screen. You can open that up and then type in your questions. Jim and I will be monitoring that today, so we can answer your questions either directly, or if it's something that would benefit everyone on the call, we'll make sure that we ask that. We would also like to remind everyone, fall is coming, and you'll probably get a whole lot of telemarketers and junk mail and everything else. So now is a good time to schedule a benefits review, or if you have specific questions about what we discussed today, go ahead and take out your smartphone, put it in camera mode, and then just hover here over this little QR code. And basically what that will do, you can put in your information on what you have questions about and where the best place is to contact you. And then Jim Kane or I will reach out to you. Jim and I are the district managers here in Ohio. And we're also very fortunate today. He and I will be presenting the information and answering your questions today, but we're also very fortunate to have with us Gary Monto, the president of your Police and Fire Retirees of Ohio. And Gary, how are things up in the Toledo area?
Everything in the Toledo area is great. We haven't had too much rain, no flooding. It's a beautiful day out today, and we're happy that it's not 99 degrees.
Yes, it's a beautiful day for August. So, and Jim and I really enjoy working with the Police and Fire Retirees group. And here in Ohio, we not only work with PFRO, but also the Ohio Retired Teachers Association, the School Employee Retirees of Ohio, and the Public Employee Retirees, Inc. And, one of the biggest things that we do is help folks answer questions or help solve problems. And one of the things that, since AMBA's been working with associations for over 40 years, we've actually pulled together over 70 different associations in 36 states. So, just realize that even beyond the PFRO, we've pulled together a group of over 17 million people. So when an association like PFRO says, hey, these are the problems affecting our retirees, we got to have a solution. And that's really what Jim and I do on a daily basis, is help folks understand, what are some of those problems? Why are they problems? And then make sure that you understand if PFRO does have a solution to that. And, I know I really appreciate and enjoy the retirees with the police and fire. And it's been a good relationship. And, I'm always very thankful when I'm able to help one of your members, Gary. So if you could maybe just give us an update on what's going on with the police and fire retirees, the pension board, and anything else that Missy's given you the laundry list there to make sure you convey.
You assume I've talked to Missy today. Come on. Yes, I do have a short list. First off, the legislature is in the summer recess. They won't be back until September. So there's not a whole lot to report from the legislator here in Ohio. Unfortunately, the WEP program, the Social Security, where we lose 2/3 of our money, is in a holding pattern. It'll probably have to be reintroduced in January with the new Congress. But at least we've had 2 hearings, which is the first time in the history that we've had 2 hearings. If anybody has any questions, I have a name and a phone number of our legislative agent that can give you direct information if you would like. I will give it to you now if you have a pencil and paper.
And hopefully everyone does have a pencil and paper.
Okay, the gentleman's name is Greg Bennett, and his phone number is 5934. That's 614-753-5934. And he'd be more than happy to answer any questions you have concerning any of the legislature that we are dealing with. Also, on a happy note, we were able to give away 7 scholarships this year from our scholarship program when we send out tickets at the beginning of each year, and you purchase them. We were able to give out 7. We normally give out 4, so we had such a great return this past year that we decided to give out 7. That's it for me.
Wow, that was a short list today, Gary. Any
This is falling
questions?
asleep.
Any new developments or anything when it comes to the benefits and Aon or which, excuse me, is a light. I'm trying to get that brought into my vocabulary.
Okay, with the light, obviously with the open registration coming up again, I want to remind everybody that in order to keep your stipend, you have to have either your prescriptions or your medical with a light. They have several companies you can deal with, but you have to go through them to qualify for the stipend. And on that note, there will be no change to the stipend this year. The legislature has dictated that we have to wait for a year to see how the returns are coming, especially with the war with Russia and Crimea. So at that point in the discussion, I'll turn it back over to Bonnie and to Jim.
Okay, thanks, Gary. And that is an important distinction that is unique to our police and fire retirees, because remember, for you to get your stipend money, you do have to get either, if you're on the Medicare supplement track, you have to get either your supplement or your prescription plan, not both, just one or the other, through a light. Or if you're on a Medicare Advantage plan, you do have to get that through a light. And unfortunately, sometimes, Gary, we run across folks that pick up their phone to the telemarketers or, watch Joe Namath or JJ Walker on television and, deal with them, and they lose their stipend. And of course, that's tragic, because once they go off, that does not come back, correct?
That's correct. Once they drop off the rolls for the stipend, that they are not going to be allowed back on.
Yep. So folks, if you have any questions on that, I strongly encourage you to, use that QR code that you're going to see here throughout the presentation. So you can have, get some time with Jim or myself, that we can, just make sure that you're not doing anything that endangers that stipend, or that you're spending money maybe that you don't have to. So that's one of the things that we work with our retirees on benefits reviews, especially this time of year. So we'll see those going forward. And again, just to remind folks about who you're talking with today, my name is Bonnie Norris, and I'm down in the Oxford area, so Southwest Ohio. I cover about a third of the state, basically from Mercer and Auglaize south, and then from 70 all the way across over to Meigs and Lawrence counties. And then Jim works with folks in the other part of the state. But when it comes to the police and fire folks, Jim and I kind of drop all borders, and whoever needs help, we come in, don't we, Jim? So, and as you see here, this is a little bit about me. My son actually is just getting ready to start his 3rd year here at Miami. He's on the football team, so he's right in the middle of all day practices. So it's nice. The weather this morning is kind of like fall, so we're starting to think about fall and football and everything else. So, and then Jim, tell us about your ladies, because you're getting ready to have a change here too. Oh, you're on mute. Still on mute.
There you go. Can you hear me now?
Mm-hmm.
Sorry about that. This is my family. My wife is an educator in the Reynoldsburg school system. And then these are our daughters, Lauren on the right. She's a senior in Gahanna, and my daughter, Caroline, on the left. They're both taller than me now. My wife is not standing on a chair. I'm not on my knees. She's just under 6 feet tall, and I'm about 5'7.5". But that's our family, and we've been doing this about almost 10 years with the state associations, the last 3 or 4 police and fire retirees.
Yep. So, you know, and it's fun to work with our retirees around the state. And again, just as a reminder, you know, how does your association impact each one of you out there today? So a few things to keep in mind. You know, Gary gave us a great brief update on everything that PFRO is doing from a legislative standpoint. They're truly, you know, the watchdogs for you. So each of you out there can spend time with the grandbabies or traveling or doing those odd jobs or second jobs or volunteering, you know, to the point that you really don't know how you actually had time to work because you're so busy in retirement. So because Gary and the other folks on the PFRO board, you know, they are keeping an eye out on your pension to make sure that, you know, OPNF is, you know, treating you fairly and making sure they keep the retirees in mind. They also work toward preserving those health benefits. And, you know, that's why it's so important for us to make sure everyone understands the stipend system, because we don't want any retirees, you know, saying, oh my gosh, I wish we would have known that, or spending money, like I said, that you don't have to, or that you shouldn't be. And then the other thing that happens, and you know, Gary, Jim, and I know the two of us thoroughly enjoyed the play ball to get, you know, to have that interaction with retirees and link them to the local community and everything. And that's fabulous what you folks did with the scholarships. Because since we're both parents of college age students, we know that, you know, anytime a student can get a scholarship, it helps the entire family. So, you know, great job for you and all your members there. And then finally, you know, the other thing that really that AMBA can bring to the table is exclusive benefits and even member discounts on a lot of things like shopping, travel, rental cars, Sam's Club membership, sporting events, you know, whether it's professional or college, movie tickets. I mean, those are all wonderful discounts that our PFRO members get just because, or mainly because you're a member of the police and fire retirees. And one of the things that, you know, that we do want to make sure that everyone is aware of is really just the advantages that you can get in leveraging your association membership. And a number of these benefits, and you'll see here on the left, and Jim and I will make sure that everyone on today gets one of these sheets. But basically, a lot of the programs that are offered really help fill those gaps not covered by your state or local benefits. Many of the folks, you know, that's on here today live outside of Ohio. So, you know, if you do travel, are your benefits portable? And, you know, how maybe when you go outside the state of Ohio, something that you had doesn't really work anymore, or when you retired, were you able to keep what you had in place prior to your retirement? And then the other things that we look at is, you know, how can we extend benefits to your families or parents? Many of us out here are dealing with elderly parents, and sometimes we're faced with having to take off extended periods of time or juggling, you know, back and forth between a spouse. So that's, you know, one of the big things that AMBA does for folks is really help bring solutions to those problems. And today, what we're going to focus on really is what's called the Medical Air Services Association, which is a little bit of a misnomer because this program really steps in to handle the issues left over when your insurance, whether it's Medicare or commercial insurance or an employer plan, you know, sometimes those do not always kick in and pay what we think they should pay. So, you know, just like every good presentation, we want to make sure that we have goals for today and make sure that we're passing on the information to really be able to answer questions or bring up issues that you never really thought about. And so we're going to start today with really understanding the golden hour. And I know that we probably have many retired police, firemen, paramedics out here with us today. And you probably understand the golden hour, but if you've got your spouses there, we'll make sure that we explain that and why it's so important. We'll also identify the issues and costs of emergency medical transportation, who pays, who doesn't pay, why they might not pay. We'll also talk about locating the level 1 trauma centers here in Ohio. We'll talk about the myths and realities of insurance and Medicare. And then, you know, how do I have a peace of mind? What can I do to make sure that I'm not faced with really the number one gotcha is what I call it, Jim. When it comes to medical transportation, and then we'll talk about doing those benefits reviews. So Jim, as I turn it over to you, interesting thing, I always learn things about Jim. I had forgotten, but you were a paramedic at one point in your early career, weren't you?
I was. In fact, in 1986, I didn't really want to go to college. I wanted to give back to the healthcare community. I spent a lot of time in hospitals with some health concerns as a kid. And I became an EMTA, then an EMTP and paramedic in Hammond, Indiana. And I worked with the Hessville Fire Department, which is a public fire department, police and fire, and loved it. Unfortunately, I got let go. I was really small because of my health concerns, and I couldn't lift my diabetic patients, and I couldn't do the typical jobs a paramedic was required with regard to lifting. So I did end up going to school, and now I contribute to the benefits in this factor. But I learned about the golden hour in 1986. And we learned that there's about a 60-minute window immediately following any traumatic injury, which medical treatment, if you can get to that medical treatment, it'll prevent that irreversible internal damage, brain damage, neurological concerns, optimizing the chance of survival, when you deal with one of those events. If unfortunately we don't have access to advanced life support, medical transports, the box trucks, which are the ALS or the med flights, unfortunately, that hour for a lot of our more rural retirees becomes the issue of making it or not making it, or dealing with a lot more complications based on the duration of time it takes for us to get to a trauma center. Go ahead.
Hang on. There we go.
Oh, you're good. Thanks. Unfortunately, as we've all heard, and a lot of news reports have shared, the costs of these transports are rising. Another big factor that we'll get into in a bit is a lot of people think Medicare is going to cover these costs. Medicare will cover typically your first trip, closest hospital, basic life support. Anything beyond that, trauma, advanced life support, the box truck, the helicopter, it's on us. And that's where you hear these ridiculous stories of people getting everywhere between, $4,000 and $40,000 for a ground to a med flight. For our members that are in the more rural areas, we'll show a map in a little bit. There's 3 or 4 segments of Ohio that have no, capability beyond a glorified urgent care center. For those folks, some of those are taking 2 and 3 trips to actually get to the care that they need, and ideally within that golden hour. I believe in Ohio last year alone, there were $25 million paid, declined by Medicare, for emergent medical transports. And we're not talking about, the transports by, an Uber or somebody that's going to get you to your doctor appointment or somebody that's going for dialysis. We're talking about emergent medical transports for heart, strokes, falls, hips, knees, embolism, aneurysm, heart attacks, anything major where you need, level 1, level 2 care.
And Jim, here on the slide, it looks like the older we get, maybe the more ambulance trips we take.
Oh, yeah. Yeah. I mean, that makes sense. And honestly, women take a lot more ambulance trips than men. And if you think about it, the reason why, as we age, men typically have their wives, they put them in the car, take them over, they have a spouse to help them. Women, typically widowed the last few years of their lives, don't have that male in their life that can help them. Women take and you can look at the chart, it goes up exponentially between 70 and 80 plus, just based on the fact they don't have their partners. Or, widows tend to use this a little bit more. Another big deal is billing. Air Methods is one example. They've gone through some hard-edged tactics to get their bills paid. They're obviously a private med flight provider, but this is an ad out of the New York Times, not the Ohio Warren County County Register. But it talks about, how this Mark Dodson was hounded forever and ever. He's a resident of Butlerville, Ohio, down in Warren County. He had to file bankruptcy in 2013 to avoid a $22,150 bill. They were looking at putting a lien on his home. It was absolutely ridiculous. He claimed bankruptcy, and we hear this all the time. The average bill is actually about $40,000 for a med flight, compared to what it was, $17,000, $18,000 just 5 years ago. Unfortunately, med flights are not governed by Medicare. They're not governed by the United States or federal healthcare system. They are governed by the FAA. And unfortunately, we cannot control them. It's been that way since the late 70s. And unfortunately, the costs just continue to rise. Now, as you'll see, like we talked about, 59% of women will take some type of emergent medical transport. 40 or 41% of men, and again, women are higher simply because they outlive men and we tend to use a little bit more services as we age. And obviously we're using more services today more now than ever. I believe it's 32% of women are now expected to live into their 90s, and it's about 16 or 17% of men, which is crazy. But there's 5 reasons people or retirees typically require medical transport. Number 1, far and away, or number 2, heart and stroke. They call them the big 2. When you deal with those, you're typically heading to, a local facility and likely a trauma if they can get you to one. Neurological disorder. It could be a bump on the head, a brain injury, Alzheimer's, dementia, Parkinson's, senility, but neurological is another reason people are calling 911. Falls, a little less, in the July and August months, but I'll tell you, we have our share of them, makes up for the whole year, November through February, with retirees falling and using emergent medical transport. Car accidents. If your airbag goes off and they see any potential, brain or head injury, they're calling the helicopter. It's kind of a CYA move for the state of Ohio. But the bottom line is, if you're med flighted, doesn't matter who called it, you're paying the bill. And most recently, the past 2.5 years, because of COVID, we've had more ground ambulance transports because of respiratory distress and getting people on, oxygen, ventilators, whatever it's required. But again, emergent medical transport, in which if you can't satisfy your care locally, you're on the hook for that second or tertiary or all advanced life support, transports or bills. So what are the facts? The bottom line is that the further you live away from the hospital, the more you are going to pay to get where you are. There are hundreds of hospitals in the state of Ohio. Some are absolutely wonderful. Unfortunately, there are only 7 trauma centers, maybe 8. There were 12 just a couple of years ago, but unfortunately, systems consolidating, things changing, cost measures. There are now 7 or 8 in the state of Ohio. So what is the level of a trauma center? I don't know why levels 1 is not shown here, but level 1 trauma is a teaching hospital like Ohio State University or the Cleveland Clinic. They have specialty staff on for every discipline you could possibly imagine, and that staff is in that facility 24/7. When you deal with an event, they are there to take care of you. But again, that is only 7 or 8 hospitals in the state of Ohio, typically Cleveland, Toledo, Cincinnati, Columbus, and I believe Akron, and then St. Elizabeth's out by the Pennsylvania border. What's a level 2? A level 2 trauma has the same equipment as a level 1. They just don't have the staff on staff 24/7. You may, it's where you hear, hey, we had to call the doctor or the specialist in the middle of the night and he had to come in. That's a trauma too. They've got the equipment, just not the staff 24 hours. And again, within that golden hour, getting doc out of bed, we want level 1 trauma, whenever it's prescribed, so it's taken care of. What's a level 3 or a level 4? No specialist. They're basically there to stabilize the patient and get them ready for transport to a higher level facility, which is, again, your trauma 1s. Again, if you have a secondary or tertiary transport, that's on you. Now, if you're on a Medicare supplement, a plan N, a G, and F, typically your first transport to closest hospital is going to be covered. I know some of you say, hey, I live in a small township. Either they're going to cover it, it's covered through my taxes. Wonderful. But if they get you to your local hospital and they cannot handle you or recommend specialized treatment elsewhere, your local community is not going to take you down to Columbus or up to Cleveland or fly you to, Austin, Texas, if you need the MD Anderson Medical Center. So understand that despite your local townships paying for local transport, they're typically transferring you, and it is covered to your local hospital. Here's a map that does a brilliant job of explaining the limitations of Ohio's healthcare system. The red that you see are the trauma centers in Ohio. There are only 7, perhaps 8 of them. Now we have several, another handful of level 2s and quite a bit of level 3s. But again, when you deal with a major event, it's level 1 where you need to be. Now, the big where Bonnie's circling this big area that is predominantly her territory, and then over there to the right, and then the far upper left, those are areas within Ohio that have no trauma capability. So if you have anything more than a cut, a break, a bump, or a bruise, you're typically being transported from your local urgent care or your mom and pop ER into one of these other dots, which obviously the biggest ones are going to be your level 1s and level 2s. But just understand how rural areas in Ohio are. And if you fall into one of these, and if if you live downtown Columbus and you don't travel and you're fairly reclusive, you're within 10 miles of a trauma center, Mass is not that critical. Medicare will typically cover you that first trip closest hospital. But if you don't live around a trauma center, have events in your family, if you travel, if you have grandchildren outside of the area, if you go on holiday or vacation on cruises, Medicare will take care of that first trip closest hospital. Your Medicare doesn't work outside of the US. Medicare will basically bring you back to the US into Miami, LA, New York, Detroit, or Texas, Galveston, where your Medicare kicks back in. So a lot of people ask the question, why isn't this covered by my insurance? Well, most commercial policies, which are everything but Medicare, they pay off something called the usual and customary charges. Well, if you use an example of a med flight, they are not subject to networks. They're their own entity governed by the FAA. They are not subject to networks, and they don't go by usual and customary charges. So if usual and customary charges are $3,500 for what your plan believes is adequate for a med flight, well, if that bill's $40,000, you're responsible for the other $36,500. So again, it's not typically that grave, but if you do deal with secondary, tertiary medical transports and advanced life support, which a copter is always going to be, it's on you. The other issue is second bullet. Medicare's language is very tricky, and payments are based on fee schedules. We'll show you in a couple slides, but Medicare changed its verbiage in the Medicare and You in 2021 and 22 versions that says instead of we will pay for emergency medical transport, it says we may choose for emergency medical transport. And I'll give you an example of that. We recently had a retiree. She was a retired educator in Gahanna, but she at the last snow, I know it was 6 months ago, but the last snow in February, she came out on her porch to get her mail. When she walked out, unknowing that it was ice, slipped and fell. Her neighbor saw her and dialed 911 right away when she was laying in the bushes. 911 showed up. He ran across the street, got her out. She had broken her wrist by falling on it, and she broke her clavicle from falling on it. When the medics got there, they said, "Would you like transport?" Yep, her wrist was like this. She transported her. 2 weeks later, she got a bill declined by Medicare for $1,280. Declined. The reason being is she broke her wrist and her clavicle, neither of which would have eliminated her from being driven by her neighbor, calling an Uber, and or arranging personal transport for those injuries. So understand that Medicare may or may not pay based on the injury. And again, the reason we have MASA, we don't want you to hesitate in, dialing 911 because you don't know, are you going to get that, that $1,230, $1,280 bill. This is exactly the page 31 in the 2022 Medicare and You government explanation of Medicare and ambulance services. Yep, Bonnie's holding it up right now. But Medicare will cover, transports to critical access hospital, emergency, nursing facilities. But the key word, which we've highlighted there, is they may pay for emergency medical transportation, based on your situation. In some cases, Medicare may pay for limited medically necessary non-emergent medical transportation if you have a written order by your doctor, and jump through 3 other hoops that they require to do so. But a lot of people don't realize that even if Medicare does pay, on the very bottom, you're responsible for 20% of Medicare approved amount. Now, Medicare is typically not going to approve a med flight or an advanced life support box truck transport. But think about this. If they do pay, and you have a $40,000 med flight, 20% of $40,000 is $8,000. $8,000. Very few of us can afford $8,000 unexpectedly out of our pocket, plus your $233 annual Part B deductible, plus anything else that's associated with that event that you still have to come up for, whether it's replacing an automobile, other expenses, elder care. It's just ridiculous. And I have a lot of members when we chat about this, or they'll call me after one of these little webinars, and they'll say, Jim, all right, I've known you for years. You know how important this is. Do I really need it? And I tell them, your police and fire retirees and Ohio retired teachers, school employees, and public employees, we don't have broken leg insurance. We don't talk about it because it's covered by your Medicare. We don't talk about diabetes insurance. It's covered by your Medicare. We help our members understand that Medicare falls flat on its face in 3 areas: elder care, medical transport, and then typically cancer. It's kind of rough there too. But this is one of the areas we want to make sure our members address before you deal with an event. And understand that for our widows, our members that don't have strong support system locally, Medicare doesn't just pay your bills. If you're in the ER and you need assistance and you need to go to Cleveland, Toledo, Columbus, somewhere else, they'll work directly with that ER charge nurse, directly with the attending ER. If your family is freaking out because they don't know what's going on, what to do next, they just can't handle this, MASA handles everything for you. I mean, they literally tell you what to do and follow the little yellow tiles, whether you're going to the ground ER for a ground transport or whether you go into the 5th or 6th floor for a med flight. But they take care of absolutely everything for our retirees. Thanks, Bonnie.
So Jim, one of the things that you talked about is just really the limits here on Medicare, and they get to decide after the fact if it was medically necessary. So that's one of the kind of hidden things about it. But then, we have retirees on with us today that are probably know the information about this next slide. But everybody who shows up in an ambulance is not the same, are they?
No. In fact, Medicare makes it very clear in the Medicare New Book 2022 and everything online, Medicare pays for basic life support. If you have advanced life support, that is on you. And unfortunately, advanced life support is the box truck with the ICU unit in it, or it's the ground ambulance that's taking you to the med flight ICU that's taking you to a major trauma center. So examples of differences between basic and advanced life support: an EMT. What I earned in 1985, 1986 was 6 months of training and 1 test through the state of Indiana and Ohio, learning CPR, artificial ventilations, oxygen, putting oxygen on somebody and turning up the liters per minute, basic airway management, making sure you're not obstructed, spinal immobilization. If you have a neck injury, the neck, with the Velcro and the neck brace and the backboard, taking your vital signs, bandaging any wounds and splitting a break, obstetrics in the event you're dealing with, pregnant females, glucose monitoring for diabetics, and albuterol treatments, which are just a little inhaler steroid that you put in your oxygen. Those are the limitations of an EMT that's going to come to your home, accident, wherever that event is. If you need advanced life support, which is again on our retirees, EKG monitoring, we used to call them ECGs, manual defibrillation, advanced airway management, intubating someone, external transcutaneous pacing. I had to look that one up and I still don't know what it is. But fluid therapy, IV administration, pain IV therapy, needle chest decompressions, administration of critical care medications, Narcan, other major pain medications, during the event of a massive, accident or bleeding. I mean, understand that these happen to all of us. Unfortunately, we're just as likely to have one of these happen, now as we did when we were, 25 or 35 and working. The difference is Medicare is not quite as comprehensive as our major medical was when it comes to this stuff. And starting in 2013, which was the year the baby boomers started turning 65, guys, the government cut $716 billion from Medicare's budget to make room for the new baby boomers to make sure Medicare would last. $39 billion of that 716 came out of what we call other services, and that's exactly what we're talking about today. So can you prevent bad things? No, we can't. They're going to happen. They're going to happen to all of us. But the good news is we can prepare for dealing with them when we do. Bonnie, you want to pick it up from the association perspective?
Yeah, thank you, Jim. And I think the information you gave was very informative. And, as I talk to retirees across the state, many of these things are the things that blindside you, because we don't realize that there was $39 billion cut from those budgets, or the fact that, not every, person that jumps out of an ambulance is considered the same way in Medicare's eyes. Another thing that we thought was interesting, Medicare declines more claims than commercial insurance. So if you say, oh, I rode in an ambulance back when I was still working and I didn't have a bill, or everything was taken care of, just know that it's a different landscape right now. So because of all that, and because, like Jim said earlier, when it comes to elder care, that's the number one most expensive threat to our retirees. But as I say, the transportation is really kind of the number one gotcha, because unfortunately, and you folks that ran squad or were on, police or fire, that when a person's laying in the middle of their front yard or in the middle of an intersection, they're not going to say, hey, wait, I need a price check on my my medical transportation, or hang on, I got a Groupon. So because those can be very expensive, and we're going to talk about some of those expenses here in a little bit. That's why, your association, along with the other associations that we work with, said we've got to have a solution for this. So the solution comes with the Medical Air Services Association. And just know that this is a little bit of a misnomer, because MASA goes far beyond just taking care of those shocking bills that come from the air services. It's basically any ground, any air, and anywhere. And when I say anywhere, just know that is basically anywhere you are on the planet, except for places like Antarctica or the Ukraine, or North Korea. And most of my retirees, I might get a bite, Jim, on somebody that says, oh, I'd kind of like to go to Antarctica, but only in the summertime. But the other places, folks don't want to go or go back. So, but just know that MASA is that solution. And, and I think, Jim, you said it earlier, when you are on Medicare, just remember your Medicare really doesn't work once you're beyond the United States. So what MASA works to do is, if something does happen to you while you're outside the country, they will get you back here to the United States, where your Medicare actually does kick in. And so, the question we get is, well, who or what is MASA? And basically, it's the solution to the problem. It pioneered, this industry, and right now there's over 2 million active members, and that goes up every year. The program has been around since 1974, and I'm happy to report, Jim, as far as I know, they have never turned down a claim for one of our association members. Is that correct?
Right.
Yeah. So it has a very good rating, an A+ rating, actually, from the Better Business Bureau. And keep in mind too, if you do find yourself, transported to that first hospital that Jim was talking about, maybe it was the doc in the box kind of place, and you need help, or your family at that point would need help trying to figure out how to get you on to the next level of care, just know that MASA does have skilled paramedics, registered nurses, physicians on duty to help make those arrangements, get the transportation lined up that you need. And they even have those folks in various places around the world. So when you are traveling, when you've given them your itinerary, if something happens, you can contact them. They'll tell you what a good quality hospital is close to you. And in the event that you're in an area that English is not the first language, MASA will even provide a translator to help make sure that you or your family members are making the best decisions for your health care. And then also know MASA is very protected. There are no dollar limits on, each trip, and there's no dollar limits on the number of trips or times that you use your MASA. And that's incredibly important. And, we've talked a lot about, anywhere, and talked a lot about, outside the United States when our retirees are traveling. But, the majority of claims that MASA is actually paying right now is for those ground ambulance trips within a 20-minute radius of your house. And case in point, back in February of 2020, just prior to the pandemic shutting down the world, my son was a senior right here at Talawanda, and he was headed back in. We ate supper. He was headed back into town for lacrosse practice. And I got the phone call that no parent ever wants. It was his phone, but he was not on the line. And he had deer jumped out in front of him. He ended up totaling his truck. So my husband and I jumped in, drove the short trip up to the accident scene, and to find my son, his nose was completely shattered, blood everywhere, big gash on his leg. And, small town here in Oxford, we know most of the folks that were on the squad. They're either baseball, coaches or neighbors. And they said, do you want us to transport him, or do you want to take him in? I didn't know what type of head trauma he had. So I said, no, let's just have the squad take him in. So after the fact, for 2.3 miles, I received a bill for $688.10. My first was to panic, my first reaction, because, I had a graduating senior and all this going on. I was like, wait a second, I have MASA for my family. That's my peace of mind. So I simply sent the bill to MASA, and they took care of everything. And that went to, one of those claims. Obviously he was well within the 20-mile radius, or the 20-mile radius of the house. So those are the majority of bills that our folks that MASA is taking care of for our retirees. And when we talk about the real cost of ground ambulance, and again, many of you folks out there may have actually staffed the ambulances or seen this part. So this may not be, come as a shock to you. But let's also keep in mind, as Jim mentioned earlier, many of our first responders locally are, funded through spaghetti dinners, through levies, and more we're seeing those expenses go up, and the amount of tax dollars or fundraising just can't keep up. So then that results in bills. So here are just a couple of examples. As we look at the real cost of the ground ambulance, there's the base rate just to get it to roll out of the emergency house. And then you have your mileage. And as we see here in this case, and this did come from a real retiree of ours that we work with, their bill that, pay this amount, which those four little words can be a tremendous scare. Pay this amount for this individual was over $1,300. The one down here, 9 miles, their pay this amount was over $1,000. And, keep in mind too, when it comes to air ambulance, and Jim showed everybody the article that was in the New York Times, the rotor charge, the base rate just to fire up the helicopter in this instance was over $33,000. And so when they added everything else in, the total charge was nearly $42,000. And after their commercial insurance payment, this individual was still left with a balance of over $8,300. And, and like we said, when MASA works, it works no matter where you are on the planet. And this couple was in Florida on their bucket list trip. And unfortunately, the gentleman had a massive stroke. So MASA worked with them to get the pair of them back home to Florida, where they lived at the time. And unfortunately, he didn't make it after he got home, but she would have had a bill for $58,000. But MASA made those arrangements and took care of the program. And you might be thinking, well, Bonnie, that's great. That was Texas, Hawaii, Florida. It doesn't happen here. So to get us a little bit closer back to home, here was one of our retired teachers in Indiana. Her husband had to go by life flight, and his bill was over $38,000. And again, she didn't pay anything because all she did was send her bill onto MASA, and everything was taken care of. And then this retired teacher just in Urbana, Ohio, her husband was out playing with his chainsaw, and a 17-minute flight to Miami Valley, which is one of our other area level 1 traumas. Their bill was over $21,000. So, basically all she had to do was send the bill to MASA, and they took care of it. So what exactly does MASA do? It's not the folks that you call when you're having an emergency. You still call 911, and then MASA helps with all the trauma that's left behind, either through the bills, or if you do need help, getting those flights lined up to another place like, Cleveland Clinic or Mayo or MD Anderson, that type of thing. But it is a supplement to your health insurance coverage. So, it helps pay when you're stuck with either the co-pays, deductibles, maximum out of pockets with your Medicare Advantage plans, or, just that 20% that's left over, or if Medicare comes in and says, yeah, you know what, that wasn't medically necessary in our eyes, so we're going to decline the claim. And Jim, that was one point we forgot to make during yours. What does happen when Medicare says, nope, we're not paying it? Does the Medicare supplement still continue to pay?
No, unfortunately, the way Medicare works is your provider, whether it be the ambulance carrier, your doctor, your therapist, with all Medicare bills, your provider bills Medicare. If it is a reimbursable expense, Medicare will pay its 80%, and then they send the 20% to your supplement. If Medicare paid their 80%, your supplement will pay their 20. But unfortunately, in those three areas like elder care, medical transport, and cancer, there are significant gaps where your carrier submits the bill, Medicare declines it, which triggers an automatic decline from your supplement, which triggers an automatic patient responsibility. You pay this bill.
And Jim, one of the things I know in working with our police and fire retirees, we have a number of folks out here that are still on the Medicare supplement plan L's. And they actually only pay 3/4 of that 20% that's left behind, as long as it's an approved charge. So again, those are things that some folks don't realize, that there is that gap and that you might be responsible for. So,
Yeah,
again,
and the other thing, I don't want to get off on a tangent here, but Gary mentioned this in the very beginning. You only need to have either your supplement or your drug plan through Alight or Aon, whatever they're calling it now. But understand that if you think you're paying too much, or you find that you have networks and co-pays and deductibles, and you're just not aware of the option through police and fire retirees and AMBA, definitely scan that little code and request a benefit review for Bonnie or myself to come out and chat with you, where some of the services they cost a few bucks a month. Medicare is that area where we can typically save people, especially if we find they were on the Alight or the Aon plan. We tend to have a little bit better rates through the AMBA system. So I'll let you keep going, but I want to throw that out there.
no, and that's good, because one of the things I know that Jim and I both spend a lot of time on, because we don't want any of our retirees to say, oh my gosh, I wish I would have known that. We do those benefits reviews to make sure you truly understand how your benefits work. Because, let's face it, folks, when you guys made that change over there about 3 or 4 years ago, you didn't get a whole lot of education. And Jim and I painfully make sure that, our retirees do understand how everything works, and where there could be areas that you're blindsided or just paying too much for your benefits. And, one of the things that we just about always talk about is the MASA, because it does button up a lot of those areas that are truly citable offenses, if you will, because MASA will actually help, provide those emergency air transportations, cover the cost of the helicopter transports, pay those ground ambulance bills that are left over. And folks, because of COVID, we've seen, obviously the ground ambulance usage go way up. I actually had one retiree in the Wilmington area. His wife took him to the urgent care. They looked at him and said, oh no, you need to go to Miami Valley, because he had COVID and it was so bad. He got his ambulance bill, from the urgent care to Miami Valley. It was over $1,400, because Medicare told him, well, if your wife could have driven you, or since your wife drove you to the urgent care, she could have taken you to the hospital. So those are the kinds of things that truly get you blindsided. So MASA also takes care of, like we said, any place on the planet, they will make sure that you get back home. Any type of return transportation, like the couple from Hawaii, that they got them back to Florida. Any type of escort transportation. So if you are away from home and you get laid up in a hospital for more than 7 days, MASA will make the arrangements and bring a family member to you, to help you with any of those health decisions. Vehicle return. A lot of folks drive to Florida, drive, to Arizona, or maybe you've just rented a vehicle and that, now you're in the hospital and your rental car sitting in the parking lot at the hospital racking up rental dollars. So Massa will make sure your vehicle or your rented vehicle gets back to where it needs to go, as well as your minor children, grandchildren return. And then it also takes care of the fur babies too, up to 2 pets. If you do travel with your pets, they'll make sure that the 2 of your pets get back home. Also, we have several folks that, later in years, you are looking at organ transplants, so it will help make those arrangements, get the organ to where it needs to be, or you to where you need to be for the organ transplant. And again, worldwide coverage. So you have that protection no matter where you are on the planet. And there's a couple different ways to secure the peace of mind. The way that we're talking here on this slide, you can get the program for either a 5-year or a lifetime. And with that, you do get your little Medic ID bracelet. I think Jim and I both have ours on today. I always wear mine. But basically, if you do fall like his teacher there in Gahanna, and the neighbor comes to scoop you up, and then the squad shows up, obviously squad members are trained to look for things like this. So they just flip it over, they get their phone out, scan that QR code. Now they know who you are, who your emergency contact people are, who your doctors and healthcare providers are, what type of medical history do you have, what type of medications are you on. So now, instead of them running into the house and trying to find the basket, in your refrigerator or, on your counter of all your medications, they have all that information one place, so they can begin treatment and really help in that golden hour, like we talked about at the beginning of the program. So you might be thinking, well, do I really need Massa? Why do I need Massa? Basically, folks, this is the best coverage available, whether you're at home, anywhere in the United States traveling, international travel, or, especially if you need that ground or air transportation to stay away from those #1 gotcha, those bills that we talked about. And because you folks are members of the police and fire retirees, you folks actually save 40%, because you can go out to the internet and just purchase it, but you're going to pay more, because here's just another area that your association has your back. Massa also waives their $60 membership fee, because you folks are a member of the police and fire retirees. And then finally, it is exclusive for the members, and just know that there's really no claims paperwork, no saying, oh, we're only here from 8 to 5. You do have that 24/7 support. And with the membership, if you are interested in this, make sure you scan the QR code or reach out to Jim and I personally. But one thing, as we deal with a lot of widows, you're living at home alone, and maybe you can't call the neighbor in the middle of the night to take you to the emergency room. So you are calling 911 for the squad. The pricing for the single folks is just $27 a month. So Jim, that's really less than $1 or less than a cup of coffee at the Speedway, not even Starbucks, so it's completely affordable. And really, again, this is how your membership pays for you, and how your association is watching out for you. For a married couple, or if you still have, children at home, it's just $35 a month. And then the 5-year and the lifetime that we talked about, where you get your extra benefits. And folks, if you do have any questions, I do want to remind you, just put it there in the chat. And again, here is the QR code. And regardless of, if you're interested in Massa or not, this is the perfect time of year to do that benefits review, because there are changes. I know many of you watch the news programs and see that there's new legislation coming out. There's been those cuts to Medicare, and you have questions, and you also wonder, it's like, why is Joe Namath and JJ Walker yelling at me on every other TV station? Jim and I help you folks figure out and understand, because again, we never want one of our retirees to say, oh my gosh, I wish I would have known that. And we sure don't want you folks spending money or missing out on benefits that you've earned and deserve. So Jim, do we have any questions there in the chat?
No,
Okay.
no, you've done a brilliant job. I think we've covered everything.
Okay, any questions,
Everything looks really
folks? Good. Okay, I do encourage everybody, and Gary, I'd be remiss if I didn't say this for Missy. If you have not paid your dues yet for PFRO, please make sure you get those in. If you need help doing that, we can help you with that, or just contact Missy there at the office, because membership truly has its privileges. Hopefully we've shared with you folks, shared that with you folks today. And the other thing too, there are a lot of discounts that are available for retirees. So we will make sure that everyone here today receives one of those benefit sheets that we talked about. And some of those discounts, again, are discounts on shopping, Sam's Club memberships, rental cars, hotels. I worked with a gal the other day. She was planning a girls trip, and just on the hotel discount, she'd saved over $800 for her trip. So again, folks, membership has its privileges. Plus, why not support the organization that is watching your back down at the State House, in Washington, D.C. So, I think we might have a question. Okay, so an individual said that they'd scanned the QR code, and yes, we will get that in. And then folks, it will either be Jim Kane or myself that will be contacting you. So it's not, some telemarketer or anything. I mean, we're the ones that, we'll be reaching out to answer your questions. And then if you're not comfortable with the QR code, my email here is bonnie.norris@amba.info, and Jim is jim.kane, CAIN, @amba.info. Or you can always call Missy at the office, and I think she's got me on speed dial, Gary. So, and Gary, did you have anything else to add for PFRO today? Oh, we need a microphone. Click.
So no, ma'am, you guys did a great job, and we appreciate all your help.
Okay, well, folks, have a wonderful day. Enjoy the August weather. It's not hotter than snot. So get out there and enjoy the kids, the grandkids, and everything else that you've got going on, and be safe.
Yep. Thanks for your service and support. We appreciate you all.
Yes, thank
Thanks,
you.
guys.
Bye-bye now.
Mhm. Bye.
Hey, we got through one.